Our next speaker is Dr. Madharia, and he's going to talk about LVA for diabetic retinopathy. Every conference we have been listening to diabetic retinopathy presentation by Dr. Madharia. Let us see what this time he has to tell us about low visual aids in relation to diabetic retinopathy.
Thank you, sir. Good afternoon, respected chairperson sitting in the dais and the respected audience of the dais. A lot of things has been already described, and as Dr. Agarwal sir told, the low visual aid for the glaucoma very nicely. The necessity of low visual aid among the patients with the diabetic retinopathy. As we all know, India has become the diabetic capital and it will remain for 30 years. So the distribution of the diabetes in all over world, it is increasing. And according to the International Federation, there's 415 adults, the millions people are having the diabetic retinopathy, and by 2040 going to increase. As, according to this uh, Smart India study, diabetic retinopathy, in diabetes 12.5% prevalence of the diabetic retinopathy, and 4% is having the vision threatening. These will require the low vision aid. The message: the early diabetic and the treatment of diabetic retinopathy are crucial to prevent the diabetic blindness. We all know the clinical features of the diabetic retinopathy. It is the mild and the moderate severe. Usually the severe non-diabetic retinopathy, they require the visual aid, and these are all the proliferative diabetic retinopathies. They their vision become almost a hand movement to the counting finger. They require the low visual aid in case of the diabetic retinopathy. So these patients, usually the rural patients, they come to us with the hope of the good vision, but we know we can't give the good vision even with the best operation. So here comes the scope of the low visual aid. The, all the definitions and everything has been already taken up by my previous speakers, and the classification has already been told by our Dada. So the functional effect, the loss of the central vision, which we get in case of the macular degenerations and difficulty in readings, which is usually having after these severe diabetic damage. Then the loss of peripheral vision we get in retinitis pigmentosa. Then the cloudy vision we get. The goal of the comprehensive low visual aid examination is the visual rehabilitation. This is to identify and evaluate and to assess the ocular health, emphasize the need of the patient's beneficiary, clinical assessment, maintain and improve the visual function, the optometric rehabilitation, the appropriate visual rehabilitation. The indications we are dealing with usually mostly with the adult, and in diabetic retinopathy we are more concerned with this. Then different types of the low visual aids which we are having, as it could be optical, non-optical. It was just discussed by Agarwal sir in detail. Usually these are the uh, elderly patients who requires the magnifying glasses, and then different magnifiers, the hand magnifiers, these are required to read, and it has got its own advantage, disadvantage. Then some people like the stand magnifier, then the closed circuit usually called low visual optical devices for the distance. It could be telescope, as it has been already described. Then different type of telescopes are available. Then the non-optical devices. Then for the illumination this is required. So these are different devices are available, and uh, in the last we can conclude the diabetic blindness can be prevented, and those which unfortunately come into the category of the visually impaired, we can provide them a definite device. Thank you very much.
Thank you, Dr. Madharia. I agree with you. We all are realizing right now also that diabetic retinopathy is coming as a tsunami in present scenario. In last couple of years, there has been a substantial rise in diabetic population, and now we are seeing more number of cases of severe proliferative diabetic retinopathy, uh, having a potential threat for the patient to go blind if not treated in time. So thank you very much